people thought that I was going to be the first tennis pro or the first African American, but I'm actually the first vegan to be president of the American College of Cardiology. As it turns out, there's really widespread recognition. I think that there's almost no one in the organization who had not heard of Dean Ornish or had seen Ornish versus Atkins, or they had some idea about it. And there's a general acceptance that more plant-based nutrition would be healthier than the sort of thing that is in the American diet. I think we've captured the American population with the big sort of opposites. I think they're very effective. There's a gentleman who was running the Heart Attack Grill, or you probably heard about that one, right? And he's very pointed about how he used to be in the healthcare arena, and he realized that people weren't listening. So he just went the opposite way to make a point. And everyone is sort of appalled at this, and then they hear about the spokesperson for that dying, okay, of heart disease. And they recognize that there really is a relationship between diet. Everyone knows it. The question is, what are you going to do about it? And how far are you personally willing to go? And so what I have found with the American College of Cardiology, because of our role in trying to improve heart health, is widespread acceptance. And every person I meet is, and have a discussion about this, is interested in trying to improve their own diet to some degree. When the president has the privilege of putting on events, such as the executive committee will come to Rush University for a meeting, and all of the food will be plant-based nutrition. Or I'll take out the executive committee to a restaurant, all plant-based nutrition. They love it, and they feel better about the fact that they're able to do something healthy for themselves as well as pass this knowledge to their patients. So I wasn't too concerned about it because I'd been with the college for a while as a board member, and I understood how altruistic most physicians, particularly physician leaders, really are, and but I am surprised that I've gotten such widespread acceptance of the principles behind it, trying to eat healthy. And the question is that I think we need to really address is how can we move the needle to go even further than most people are doing right now. We still have a lot of our members who will go ahead and say, okay, I'm going out for a steak dinner. I'm going to take a dose of a statin, and I hear that from my friends, and I say, well, suppose we just substitute them both. Okay, you can take a veggie steak instead, and then you won't have to take the pill.